On their first date, Sarah Walk and Donovan Casey jumped out of a plane together. They could never have imagined that just a few years later they would face a moment much more terrifying.
I knew she wasn't playing a joke. It was complete, eyes folded up into the back of the head. The whole thing was a horror show. It was an absolute horror show.
They were getting ready for bed when suddenly Sarah stopped breathing. She was in cardiac arrest.
I went into that classic freeze flight. Human behaviour response was just frozen, trying to pray for somebody to help me. Realised I couldn't do that. I couldn't run away. I was literally having a physical and mental breakdown. The mental breakdown from the trauma of what was going on, and the physical breakdown from the sheer exertion of the CPR. She was down for 40 minutes, but the paramedics were 6 minutes away.
Miraculously, the team of paramedics brought Sarah back to life. But each day continues to be part of her recovery. And Donovan has always wondered how different everything could have been if he'd just had a defibrillator in his home.
I started researching while Sarah spent her 100 days in hospital, 13 days in ICU, in a coma, and I realised there was wonderful technology out there, but because it was so expensive, it wasn't readily utilisable. I started the research then, and that started with reading every medical journal article that I could get my hands on to do with defibrillation.
And what he discovered was shocking.
Cardiac arrest is what happens when the heart stops beating unexpectedly. And this condition is the quintessential time-sensitive emergency. It's something that happens across the age spectrum, and it can really happen to anyone at any time, regardless of their background medical history. This is something that affects millions of people every year, and it happens to people in the prime of their life at any moment, really. Regardless of the quality of the resuscitation that happens when professionals arrive and when patients are taken to the hospital, unless things are done optimally within those first few minutes after cardiac arrest, chances of survival are really impaired.
The more I researched, I found that up to 80% of cardiac arrests occur in the home, in exactly the situation I found. No one in the home was going to pay upwards of $2,000 to $5,000 for an AED.
That was all the motivation that Donovan needed to build his team, Rapid Response Revival. They managed to secure an ISO-accredited state-of-the-art premises in Western Sydney, and they got to work inventing this, the world's first personal defibrillator.
When Sarah had her cardiac arrest, we needed a device that didn't exist, so that's why we invented the Celade.
The most important thing is Celade is more usable. Snap Pill Stick is all you need to do to save someone's life with a Celade. It's also smaller and lighter. It's the size of a block of chocolate. It also has mobile connectivity to give you the peace of mind that it's always ready to go.
So what we have here, the Celade, looks simple, but is anything but. So underneath this simple design that's easy for everyone to use, there's complicated electrical engineering, mechanical engineering, chemical engineering, biomedical engineering. There's so much going on into this product underneath the scenes that us and our engineers have had to do to design and develop that in a medical device framework and a radio framework to achieve the regulations that we need.
The first device took 10,000 hours to make, and now the whole team together, we're producing one every 20 minutes.
The Celade personal defibrillator is already present in thousands of Australian homes. A monthly or annual membership option provides remote monitoring and replacement if the device has to be used or when the device expires. The Rapid Response Revival team are now working on distributing the devices to Europe, Asia and the United Kingdom, but they need governments to help.
Anything policymakers can do to increase adoption rates of both AEDs and CPR training around the world, I think is the bare minimum they can do. Sudden cardiac arrest kills so many people, and it is, if people get immediate treatment, it is, survival rates skyrocket. The impact to society and the economic cost of sudden cardiac arrest on our society can be largely helped with little steps. The larger issue of making AEDs more available and more affordable, I think is the big picture solution.
Investors have shown interest in Celade, but contingent on raising the price. Rapid Response Revival has turned down their offers, despite the huge commercial benefits. That's not what drives Donovan and his team, insisting that CellAid must stay affordable. Lower prices means getting the device into more homes.
If we'd had a personal defibrillator at home, I would have acted much more quickly.
And that's exactly what he hopes the CellAid will do for others, making sure no one else has to simply rely on luck to survive.